right? Good morning, Dr. Lebo, Gyno. Main event on this Friday, the 6th of May. And we have this young man, he's 50 years old, who traveled to me from Israel because I'm the best. Lebo's the best. And we're going to do an amazing job. He's 50, about 175 in weight. What are you, 5'7"?
5'9".
So he's 5'9". And he's got gynecomastia. So, you know, it's not gyno, it's a 50-year-old body, you know. I mean, really, what do you think? With eating and drinking and a little liquor, a little tequila, a little you know, everything, you know, people's lives, they're busy, they're flying here. He's a businessman, he flies back and forth. You can't go to the gym every day. And this is a body, a 50-year-old body that happens. So thank goodness, we got Lebo, we got me. He's going to eat well and exercise, but we're going to etch, define, and contour him. No lipo filling. He doesn't want that. But we're going to stealth incision, local anesthesia, armpit, nipples, belly button, and in the groin. We're going to just do his whole frontal from neck to nuts, as I say. We're going to get to the sides with my long curved cannulas. We're going to scope, define, etch, reveal all the muscles involved, which includes the pecs, the lats, the space between them all, the six-pack abdomen. You can kind of see them, 2, 4, and 6. We're going to etch that, the midline linea alba, the semilunaris, get this box out of here, a little bit of the fupa, but he doesn't really have much. Get that V to P and that great shape to his hips all the way around to the sides. All through stealth incisions, local anesthesia, Renuvion J plasma to tighten everything up. We're going to do it all. We're going to do it perfectly and properly, and we're going to make him thrilled with the results. Let's mark him, numb him, and off to the OR we go. Let's go! All right, so here we go. You want a nice, deep six-pack or just kind of like a modest? Probably a modest, right?
Yeah.
Nothing
crazy.
Nothing crazy.
I keep going to the gym, so I'm sure I'll improve it.
Yeah, nothing crazy. So what we're doing now, we're just marking him. Get there. Get down to the fupa a little bit. Don't go crazy.
When you say deep or medium, I don't understand.
Do you want like, or you want just kind of? Go easy.
Yeah.
Go easy. Especially if we're not doing fat grafting. You know what I mean?
Yeah.
Go easy. Suck in your belly. Good. Look up. Good. Especially since we're not going crazy with you.
I think I lost some weight in the last 2 months.
You look good.
I do have a little bit, right?
Fat?
Fat backs.
Well, you all have a little fat. We all have a little fat. We all have. Good. Boom. We pump you up. Come on in. Better view. Vaser, 2-ring. This is the extra long one so I can get around because I'm doing neck to nuts. In the port, need to protect the skin. And let's go. You right? So first part is melting all this stuff. I know the noise is annoying. So 2 minutes, tell me. Good. Yeah, right? So here we are. We're in the nipple incision. And we're going down, sides of the chest. A lot of doctors, when they do lipo or do gyno, they don't do the sides. Very important. Very important to do that. It's all about the sculpting that matters, not just removal of the gland or removal of the fat. It's about sculpting, leaving fat where you want it, extracting fat where you don't want it, and sometimes adding fat where you want to enhance. All right, guys, so here we go. We got this young man, he's 50, flew in from Israel for my expertise in male body contouring and gynecomastia. So it's under local. We've already worked on his chest a bit. So 2 and 2. And we're now working on his groin up. We're getting the waist from the waist. Getting this all done. And in a little bit, we're going to be sculpting it out by micro air. Of course, we're going to remove the glands. And we're going to do Renuvion J plasma to tighten everything up. No pectoral lipofilling. Doesn't want. He wants to be lean and mean. Doesn't care about a big, muscle chest. All right, guys. So here we are. Now we're doing lipo. I'm sculpting the muscles now. So here what I'm doing, everything's been melted. The glands, the fat, etching of the muscle. So now I'm just extracting the fat where I don't want it. Keeping the fat where I want it. We're not going to be adding any fat on this gentleman. He doesn't want it. No fat to be added. There. So this is a 4mm Mercedes, extra long, and bent 20 degrees. So I can get around corners. So I'm etching this line of the pec, of the lats, I'm sorry. Now lift up your hip. Lift up that hip. Good. And I can get all the way to the back. This is about, contouring. This guy, not 360, but almost. nipple incision and getting the upper six-pack. Now I'm getting down from the nipple down the semilunaris, etching the edges of the six-pack down to what I call the V to P. Getting what little gland tissue is out. We're lipoing it in anticipation of cutting it out, but there won't be much. Now we're gonna get the little bit of gland out. So again, you've already dissected it with the lipo. So this is very easy.
So there's not much?
No.
Yeah.
It's all open. So now we are finishing touches on my work. We're doing Renuvion J plasma, which is helium gas with a radio frequency spark, and we are going to tighten up the skin So I think about 1.5. So here we go.
Look the other way, my friend.
You okay? Yeah. Good. Sometimes maybe the belly is, you know. You're going to be definitely a one and done. So 1.5. Everyone. Except maybe 1 and 1. Good. So helium gas with a radio frequency spark, Renuvion. I also call this the sweeper because what it does, it goes underneath the skin and sweeps away any little goblets of fat that may be left. Turn the a little bit this way. Tilt it the other way. No, other way.
Towards the feet.
There you go. And the other side. Other two. Yeah. Dr. Lipo, gyno, 50-year-old gentleman, 170 some odd pounds, flew in from Israel for my gynecomastia and beyond expertise. We did Vaser, high definition power assisted liposculpture, gynecomastia, gland removal, Renuvion J plasma to tighten everything up, and we went from neck to nuts. So we did the chest, we did the abdomen and the flanks, even all the way to the lower back. We etched, defined, revealed, and contoured the pectoralis major muscle, the lats in the back. Look at that beautiful negative space between the lats and the pecs right there. We etched, defined the abdomen, the midline linea alba, the semilunaris going down to the V to P, the six-pack abdomen 2, 4, and 6, stealth incisions in the armpit by the nipple, inside the belly button, and inside the groin. And we did down to the fupa, the serratus anterior muscles. We did it all, and we did all the way around to the back. We did exceptional. We got out just shy of 4 liters of fat, with him. From him, we did not do any pectoral lipofilling, though I would love to. I asked him 10 times. He said no, 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 but he would have looked great, but he would have been bulky and Hercules-like, and he wanted to really be kind of stealth, lean, and mean. So if you have gynecomastia, you call me Dr. Lipo, 631-424-0101, or email me at jonathanlepowitzmd@gmail.com. Let's go.